So the benefits of having a dentist anesthesiologist who has a general anesthesia permit versus a provider that may have a conscious sedation permit is the training required to get a general anesthesia permit is much more in depth, and not necessarily pertaining to just the anesthesia, but it also is about being able to treat and manage medical emergencies that may occur. And for me, the biggest benefit to having the general anesthesia permit and that training is that we're able to manage emergency situations because we've already seen them. Whereas as a moderate sedation provider, you may have never seen any of those, and it's unlikely that during your training to get a moderate sedation permit that you saw any major medical emergencies. And so when you're trying to provide moderate sedation, you're kind of limited, especially in your training in regards to medical emergencies, but also you're limited into the depth of anesthesia that you can provide. So for some of your patients, moderate sedation may be a great thing for you and for them. However, there are patients that you need to recognize require a different level, a different depth of anesthesia. And with that depth of anesthesia also comes the possibility of more complications and medical emergencies for which, as a moderate sedation provider, you haven't received the training to manage. Whereas with a general anesthesia permit, especially trained as a dentist anesthesiologist, we've already seen a lot of those emergencies. We've trained to be able to treat those and manage those emergencies in the best possible way for the setting in which we are in an office-based setting.